Our final video clip for Chapter 11 will be about epidemiology. So epidemiology is the study of disease in populations. And so the grand central headquarters for epidemiology in the United States is, of course, the Centers for Disease Control in Atlanta. So you can think about, they're the ones who are kind of overseeing all these different things that we're talking about here with regard to epidemiology in the United States. So kind of a broader definition, epidemiology includes the study of where and when diseases occur, and it also, how they're transmitted. So all of these things are important for understanding how particular diseases are spread within the population. Now, epidemiology also, kind of like etiology, you can have etiology, causes of diseases that are not infectious diseases. Same thing, epidemiologists don't only study infectious diseases, they study non-infectious diseases as well, things like cancer and heart disease and diabetes and you name it, even workplace accidents, things like that. Information about those is compiled by the epidemiologists as well. So let's talk a little bit about some of the statistics. Now, epidemiologists are very, very concerned about statistics associated with disease. And of course, we're going to be focusing in on infectious diseases here. There's a couple of terms that you should be familiar with, because you will see these terms used a lot, and actually not just with infectious diseases. Incidence is a number. That's the number of new cases of a disease in a given area or population within a given period of time. And you get to define the population, you get to define the period of time. So the period of time could be this week, it could be the month of July, it could be the year 2015. It's whatever you want to, however you want to define it. And then prevalence is the total number of cases, both new and already existing, within a population during a given period of time. Okay, so those numbers are not going to be the same, because the incidence is those are only the new cases. So you think about something like HIV, for example, HIV/AIDS. Within a single year, there may be a certain number of thousands of new cases of that. So that would be the incidence in the United States for that particular year. But lots and lots, as you guys know, there are lots and lots and lots and lots of people, thousands and thousands of people in the United States who are living with HIV, but they contracted it before this year, before 2015. So when you're thinking about the prevalence of HIV/AIDS in the United States, it's going to include all those new infections that occurred in 2015, plus any existing ones. So this is a pretty interesting graph which shows incidence and prevalence over a period of time for HIV/AIDS in the United States. And so this graph starts at 1986 and ends over here at 2002. Pretty interesting graph, though, and the numbers, incidence and prevalence values, are so different, you need a separate y-axis over here for incidence versus prevalence over here. Incidence is going to be reported in thousands, and prevalence is, the scale is in tens of thousands over here, and it's in hundreds of thousands over here. So just keep that in mind when you're looking at this particular graph. But look at our incidence graph. So this is going to be the number of new cases in the United States for each year. And back in 1986, it looks like it was around maybe 12,000. Kept going up, kept going up, kept going up. Peaked at about 80,000 new cases in 1992. And then it started to decline, and then it more or less kind of leveled off for around 40,000 or so when you got to 1998, 99, 2000, the early 2000s. All right, your prevalence, though, this blue line, starts out in 1986, and again, we're reading prevalence over here on this scale. And at first, it wasn't going up very quickly. Then it started to take off, and the numbers just kind of keep building and building and building and building. And in 2002, the prevalence, so the total number of HIV-infected people in the United States looks like it was around 320,000. And so if we look at 2002, your prevalence was about 320,000 that year. The incidence was about 40,000. So that means this value here, 320, includes those 40,000 plus 280,000 who contracted HIV in an earlier year. They're still living with it, so they're part of that prevalence value. So those two numbers are not the same. This is something that's really good, interesting to think about with regard to the history of HIV. The incidence values in the 1980s. This is when HIV first came on the scene. We first realized that there was a human immunodeficiency virus that was beginning to cause AIDS in the United States, and so the incidence values were high for a long time and kept going up until the early 90s. Then we saw this shift downward. So think about some of the history. Now, I know many of you were either really young or maybe not even born during that time. But, what do you think was associated with that? Why did the incidence value drop like that? And so think about that. We'll post something over on the discussion board for us to talk about that. And if I don't do it, one of you guys post that over on the discussion board so we can discuss that, because it's a good thing from a historical perspective to think about. What caused this change, and then why do we think it's leveling off over here when you get to 1998 and not really dropping any further. And then the prevalence. So if you looked at a prevalence graph from the 1980s, the prevalence is not going up very quickly in the 1980s, but it's later, after the early 1990s, we really start to see that prevalence value going up and up and up and just increasing each year. So we also want to think from a historical perspective, how come it wasn't going up very quickly in the 1980s, and then all of a sudden we get over here into the 1990s and it just starts to climb and keeps climbing and continues to climb. So think about those two things, and we'll discuss that on the discussion board to kind of review some of the historical background of HIV. All right, so this is HIV/AIDS, and there are different. HIV has a long incubation period. If you remember, we talked about that when we went over incubation period as part of the stages of disease. So if you have an infectious disease that's short duration, an acute infection, maybe you just have it a few days and you get over it, those incidence and prevalence values are not going to be so dramatically different, because you get the disease, you get over it, and it goes away. So you're not going to continue to factor into the prevalence values. You only factor into the prevalence value for an infectious disease if you still have the disease. Once you get over it, you drop out of those particular numbers. And you'll see this terminology used for things like, even things like car accidents. Well, maybe you wouldn't use prevalence, maybe for car accidents, but you can have incidences of car accidents or workplace-related accidents. But think about cancer. You're for a particular year, breast cancer incidence would be the number of new breast cancer cases. Prevalence would include all those new cases plus anybody who was diagnosed in the previous year and is still living with it. All right, so sometimes incidence and prevalence are given as just raw numbers, but a lot of times they're expressed as ratios. For example, you might see an incidence reported as 5.8 cases per 100,000 people. And the reason that's done is it allows you to more carefully compare, say, a city like Decatur, Alabama, or Huntsville, Alabama, where you have a lower population, with a big, gigantic city like New York or Los Angeles or Chicago, because those kind of raw incidence values are not going to mean quite as much. How do you make a fair, if you have 20 cases of a disease in Decatur and you have 60 in Los Angeles, where is that disease more of a problem? It's not really fair to compare 20 in Decatur to 60 in Los Angeles, because Los Angeles has, the city of Los Angeles has a population of almost 4 million. Decatur only has 50,000 people. So what you do is you express the value as what was the number of new cases per every 10,000 people in that city, or per 50,000, or per 100,000. And that allows you to make a fairer comparison between different geographic locations. So that would be called the incidence rate or the prevalence rate, where you have a value out of 10,000 people, or 1,000, or 100,000, or 1,000,000, or 10 million, whatever it may be. All right, epidemiologists report data in many different ways. They love statistics. They love to take a look at different factors associated with who is getting an infection, what age group, what geographical location, and so forth, and so on. And these are figures from an older textbook that we used to use. Check out the ones in your textbook. They've got some great ones in there as well, just so you kind of have a feel for different ways that epidemiologists report data. You've probably seen maps like this before. Like this could be a map of the number of new influenza cases diagnosed during the week of March 6th across the United States. And so they'll have a value representing the incidence in each state. Or you might graphically look at the number of cases for every million people in different age groups. So this type of information is beneficial because it lets us know, okay, is this particular infectious disease only impacting children? Is it mainly impacting the elderly? Is it impacting everybody? Is it impacting college-age populations? That type of information is important for helping us understand the nature of a particular infectious disease. And then we like to see, how changes in cases, in the number of cases occur over time. This is a chart showing Lyme disease cases from 1992 to 2007. And you'll see some years it spikes and some years it goes back down. And you want to know, okay, are these number of cases going up or are they going down? Because, like the Centers for Disease Control, one of the things that they do is they're big into education. They're supposed to educate the public about infectious diseases and what's out there and how do you protect yourself from it. So they're going to want to look at data like this to see whether their educational campaigns are working. So different ways that you can look at the incidence and or prevalence values for particular diseases over periods of time or by age group, geographical locations, etc. All right, some more terminology that we hear quite a bit when we're thinking about infectious disease. And so let's talk about this. So endemic disease, sporadic, and epidemic. Let's talk about that. An endemic disease is one, they're kind of showing you a map over here with some little spots. So those are locations where incidences of our little imaginary infectious disease are occurring. So if you always would expect a certain number of cases of an infectious disease to be occurring in your area at any given time, then you would say that that infectious disease is endemic to your area. Like let's say there are always, any standard week, you would expect 2 cases of this infectious disease in your geographical location. If that's always the case, then it's endemic. If an infectious disease occurs just from time to time, so you don't always expect cases of it, but from time to time it will appear, then it's considered to be sporadic. You have sporadic occurrences. An epidemic is any time you have more incidences than you would normally expect for a particular infectious disease. So that's what they're showing. We've got an epidemic going on here in the United States in several different areas. There's a whole bunch of cases of a particular infectious disease above and beyond what you would normally expect. So that's going to be an epidemic. And the numbers don't have to be high. So you could have an infectious disease where you might expect 1 case per month. And if you have 10 cases in a given month, then that's going to meet the definition of an epidemic. The geographic area doesn't have to be large. You could have an epidemic, at a campground. You could have an epidemic here at Calhoun Community College. Your population is going to be whatever you define it as being. Pandemic, maybe you've heard that term before when we had the H1N1 flu pandemic a few years ago. So that's an epidemic that is occurring on at least 2 continents. And pan, that prefix sometimes means worldwide. But with pandemic, it doesn't actually have to be worldwide. It just has to be occurring on at least 2 continents. So you've got more cases, more incidences of a particular infectious disease than you would normally expect on more than 1 continent. Lots of things are a pandemic, like HIV/AIDS is a worldwide pandemic. A little bit more terminology here on epidemic types. And check out in your textbook, and there are some homework questions as well, on graphical representations of these 3 different epidemic types. Epidemics can be classified as point source, common source, and propagated. So a point source, this is where all of the individuals who acquire the disease were exposed to the same source, and there's usually a short time frame for exposure. So imagine you're at a picnic and the potato salad has salmonella bacteria in it, or Aunt Mary's fried chicken has salmonella bacteria in it, or Uncle Bob was picking his nose and got Staph aureus bacteria in the barbecue, and the Staph aureus caused food poisoning to some of the people at the picnic. That would be a point source. So all of these people, they all ate the potato salad, they all got sick, they didn't transmit it to other people, and the epidemic peters out. They all get sick and then they get better. So a lot of times those are going to be infectious diseases that are non-communicable. They're not going to be spread to other people. That would be point source. Common source is similar to that, but you have an extended period of exposure. Like, let's say a water supply becomes contaminated with some sort of protozoan, and nobody figures out what's going on for a while. So maybe there's a week or 2 weeks when people are drinking this contaminated water and coming down with this protozoan illness. That would be a common source epidemic. What did everybody have in common that became ill? So those two are kind of this very similar, point source and common. It's more about the exposure duration that separates the two. And if you graphed out the incidences associated with these two types of epidemics, the graphs would look a little bit different. So you want to take a look at that in your textbook and homework. A propagated epidemic, this is a communicable infectious disease that is spreading through a population for a period of time. Now, there can be some overlap here, like let's say people pick up some organism that is communicable from some common source or from some point source. So you could have a point source epidemic that becomes propagated as it spreads through a population. Another term, the index case, maybe you've heard of this before. The index case is the first person in an epidemic. So like with the H1N1 flu outbreak that we had a few years ago, the index case was determined to be somebody in Mexico. That was the first person who had that, was infected with that particular strain of flu, and then I believe it was a Mexican farmer. He transmitted it to other people. They transmitted it to other people, and then it spread throughout the world. So if you were unlucky enough to be the first person in an epidemic, you were called the index case. And transmission is very interesting. Epidemiologists do a lot of very interesting things because different infectious diseases, sometimes in the news if you read articles about Ebola virus, for example, why didn't the Ebola virus epidemic spread as dramatically as people once feared? Well, one of the reasons for that is, as even as horrible and gruesome as Ebola virus is, each individual person who had an Ebola virus infection was typically not infecting all that many other people, maybe one or two on average. Then other infectious diseases are so contagious, for example, the measles, extremely contagious. A single average person infected with measles virus, if I remember the number correctly, is going to transmit that to about 16 other people on average. So some microbes are just spread more easily than others, and that's another thing that epidemiologists will look at. They like to compile statistics and try to figure out how transmissible a particular infectious microbe is. The Centers for Disease Control in Atlanta posts a publication every week that's called the Morbidity and Mortality Weekly Report. So morbidity and mortality, those are a couple of terms you should be familiar with as well. Mortality means deaths. Morbidity sounds morbid, so it almost sounds like deaths as well, but morbidity is just referring to people who have become sick. They're in a disease state. Any change from a state of health is morbidity. So this MMWR, or the Morbidity and Mortality Weekly Report, is put out by the Centers for Disease Control, and you can find that online. I've got a link here in the full PowerPoint version for you, and you can click on that and check out the MMWR on the CDC website. Pretty interesting reading. Actually, the cover I've got here, there's an article on occupational aviation fatalities. So again, they're compiling statistics on not just diseases, but workplace related accidents, other types of accidents as well. The CDC publishes lots of interesting graphical epidemiological data, like this is some information on meningococcal disease, which causes meningitis, especially in children and adolescents. But this is an important thing to think. Let me click on this, notifiable diseases. Hopefully this will open up my web browser here while I'm doing the video. Come on, it's being slow. The Centers for Disease Control has a list of infectious diseases in the United States where if your medical facility diagnoses a case of that particular disease, it has to be reported to the Centers for Disease Control. This is a computer-based system, so in all likelihood, many of you guys, it'll be part of your job if you're working in nursing especially. You might have to report particular infectious diseases to the Centers for Disease Control. Okay, I finally got this to open, but on the CDC website, there is a listing of the infectious diseases that are designated as notifiable at the national level. And so there are a whole bunch of them. Some of them are very rare, others are much more common. But if you look through here, it's interesting to see what has to be reported to the CDC. Things like anthrax, West Nile virus, botulism, we've talked about that, chlamydia trachomatis, very common sexually transmitted infection. Cyclosporiasis is caused by cyclospora. That's a type of protozoan that sometimes contaminates produce. Dengue fever is an emerging type of infectious disease in the United States transmitted by mosquitoes. It's been pretty common in tropical parts of the world for a long time, but it seems to be spreading into the United States is one of those things that you guys will probably start hearing about. Giardiasis caused by Giardia protozoans. There's gonorrhea, and so forth and so on. Listeriosis, we've talked about that before. Measles, meningococcal disease, we were just talking about that. Rabies, and some of these are extremely rare. Others are much more common. Salmonellosis, for example, caused by Salmonella bacteria, would be an example of something that would be fairly common. All right, so that's going to conclude our little video clip here on epidemiology, just kind of giving you an overview on those topics. And we are finally done with Chapter 11. I know that's a pretty extensive chapter, and I've added some additional information to it, which is why you only have one chapter for that second test for this particular unit. So as always, don't forget, let's discuss the history of the HIV incidence and prevalence data on the discussion board. And if you have any other questions about the large amount of material from this particular chapter, please be sure to post those on the discussion board so that we can all talk about them.